Yeah, so there's some really important findings and practice-changing studies at this particular ASH meeting. I think in no particular order, one major finding is in Hodgkin lymphoma, that the replacement of bleomycin in ABVD with the antibody drug conjugate brentuximab vedotin does seem to improve progression-free survival in patients with previously untreated Hodgkin lymphoma. Whether this will translate into an improvement in overall survival is to be determined, although there's a hint of perhaps an early benefit. At this point, we don't know. There was some trade-off in toxicities, and there's certainly increased cost that's being discussed, and one of the controversies is really, is it worth it? And so I think that may not be definitively answered at this point, but that's the study was a very interesting finding that may lead to some change in practice for patients with previously untreated Hodgkin lymphoma. So that was one. A second major finding hasn't been presented yet and is slated to be presented tomorrow morning, and that is looking at venetoclax in combination with rituximab in patients with relapsed CLL. Right now, venetoclax is pegged only for patients with a high-risk form of CLL with the deletion of chromosome 17p. And what is on the agenda for tomorrow is a trial called the Murano study that found that in all patients with relapsed CLL who've received prior chemo, that venetoclax plus rituximab looks to be superior to chemotherapy plus rituximab in the form of bendamustine. So that's going to be a major finding that I think will change how we treat relapsed CLL and certainly make venetoclax an option for more patients than it's currently an option for. That's number two. A third major study is an antibody drug conjugate called polatuzumab. So this is basically, to my knowledge, there has not been a study in patients with relapsed diffuse large B-cell lymphoma that shows a survival advantage when patients are not eligible for an autologous stem cell transplantation. So this was a study that compared bendamustine rituximab alone versus bendamustine and rituximab plus the addition of this antibody drug conjugate polatuzumab that showed dramatic improvement in outcomes. It was a fairly small study. It was only phase 2 and not phase 3, but they found improvement in response rate, progression-free survival, and even overall survival. And so I think that is a potentially practice-changing study for patients with relapsed diffuse large B-cell lymphoma. And then I would say probably a category of really interesting studies looked at the use of CAR T-cell therapy in relapsed diffuse large B-cell lymphoma. We saw long-term follow-up regarding the KITE product. We saw presentation of the Novartis results, and we saw presentation of results of the Juno product. All of them look to have significant efficacy in patients with relapsed large cell lymphoma, and look forward to hearing more on those data in the future. A lot more to go with CAR T-cell therapy.